Hello everyone. So for this presentation, our topic is trauma nursing. This project was done by Adela, Arlish, Karina, Natasha, and Bandana. This presentation, we will talk about what is a trauma nurse, how to become a trauma nurse, the environments trauma nurses work in, and the challenges of being a trauma nurse.
What is a trauma nurse? Trauma nurses are in acute care settings, provide specialized, immediate, and comprehensive care to patients to help stabilize, treat them, to ensure the best possible outcomes for their related critical conditions such as life-threatening injuries or illnesses.
How to become a trauma nurse? In order to become a trauma nurse, you will need to complete a nursing program in a community college or in a university. You can earn your ASN or your BSN. After completing the program, you can take the NCLEX exam. The NCLEX exam is a test that basically tests your knowledge, your skills, and your critical thinking in nursing. After passing this exam, you are considered a RN. You can now start applying for jobs in the ER or in the ICU. But in order to become a trauma nurse, you will need to have at least 2 years of experience or at least 1,000 hours. After having this experience, you can now start enrolling in trauma courses such as TNCC or TCRN, which is Trauma Certified Registered Nurse.
There are many types of trauma nurses, some of which include emergency room trauma nurses, intensive care unit trauma nurses, pediatric, surgical, orthopedic, neurology, and trauma nurse practitioners. What are the roles and responsibilities of trauma nurses? ER trauma nurses provide immediate care by triaging and stabilizing the patients who may be in critical condition and require immediate response and treatment. ICU trauma nurses provide care for patients in critical condition, which may include life support. Pediatric trauma nurses provide physical and emotional support for children who have suffered physical trauma or injury. Surgical trauma nurses are nurses who assist doctors in the operating room for trauma procedures. Orthopedic trauma nurses provide care for patients with musculoskeletal injuries such as fractures, breaks, and dislocations. Neurology trauma nurses help with patients who have brain and spinal cord injuries. Trauma nurse practitioners are advanced nurses who may diagnose and treat patients in the trauma setting.
Some of the essential attributes for a career in trauma nursing includes emotional stability and empathy, critical thinking and strong communication skills, multitasking capabilities, listening skills, ambition, resilience, competency, and dedication. The environment for trauma nurses is very fast-paced and requires them to assess, react, and make quick decisions so they can help control and lower any immediate life-threatening risk on their patients. Trauma nurses rely on a structured care approach to help provide efficient and vital care. The role is highly patient-facing, so in emergency situations, trauma nurses are the first ones who assess the patient by getting information from the patient, family, or emergency response teams to understand the extent of the trauma. Lastly, trauma nurses are responsible to treat a variety of traumatic injuries, troubleshoot various health and communication challenges.
The average salary of a trauma nurse in California is $137,000 a year. The average salary paid for a trauma nurse in San Francisco is $60.62 an hour. There are 5 main factors that influence in pay. For example, advanced education plays a role in determining pay in an entry-level position as a trauma nurse with a bachelor's degree in nursing. New nurses may start at a lower rate, while experienced nurses with a master's or doctorate degree may earn more per hour. Specialty training may also influence in pay if you have experience in transport or flight nursing. Thirdly, certification. Obtaining your TCRN, which stands for Trauma Certified Registered Nurse, and specialize in that trauma department will increase your pay rate. Location may play a role depending on demand for nurses in your area. Location also plays a role in pay. For instance, nurses in urban areas tend to earn higher salaries than those in suburban areas due to the high cost of living or greater demand for nurses in specialized nursing roles. Lastly, years of experience. Is based on pay scales. If you are a new nurse or have 2 or more years of experience, can influence a nurse's pay. A trauma nurse's schedule typically works 3 to 5 days a week, with shifts ranging from 8 to 12 hours. It also depends on the facility and their contract. Most common schedules in hospitals are 12-hour shifts 3 times a week with a few days off in between to prevent burnout. When applying as a trauma nurse, you have the option to have a full-time or part-time position or per diem position. As well, working an AM shift which starts at 7 a.m. to 7 p.m. or work night shift that is from 7 p.m. to 7 a.m. with a differential pay.
What are the disadvantages of working as a trauma nurse? First of all, trauma nurses tend to work in high-stress environments such as the ICU or the ER. Another disadvantage is nursing burnout. According to ANA, 90% of nurses are leaving the nursing profession within the next few years, and 71% of those nurses have over 15 years of experience. Also, 18% of new grad nurses are leaving the profession after working for at least 1 year in. The other disadvantages of working as a trauma nurse can be having the potential of exposure to graphic injuries and violence, which can also lead to PTSD.
Challenges in trauma nursing entails moral difficulties in making decisions, which are resource allocation. Trauma nursing frequently entails making choices about limited assets, such as whether to give some patients priority over others in situations with large numbers of casualties. The ethical ramification of patient selection and triage must be managed by nurses. End-of-life decision. Trauma nurses may be required to speak up for patients who are incapable of expressing their desires. Ethical problems may arise when attempting to reconcile clinical realities with family expectations. Informed consent. It can be difficult to quickly obtain authorized consent in emergency settings, especially when patients are unconscious or unable to give their consent. This may give rise to moral dilemmas concerning benefits and autonomy. Education and training. Importance of ongoing training. In order to stay current with emergency protocols, new technologies, and evidence-based treatments, trauma nurses must pursue ongoing education. This guarantees the highest quality of care from trauma nurses. Stimulations and practical training. Taking part of stimulations, exercise, and practical training can help nurses develop their clinical abilities, strengthen their teamwork, and get ready for real-world trauma care situations. Certifications and specializations. To advance professional and make sure staff members are prepared to handle complex trauma cases, it is crucial to pursue extra certifications like advanced trauma life support or trauma nursing courses.